In those first few incredible hours after a baby is born, something really important happens. It's a story that starts to unfold, not with words, but with a series of gentle checks that tell us all about a newborn's health. So today, let's take a guided tour of that very first chapter, the newborn health exam.
So what is this first checkup, really? You might be picturing something clinical or scary, but you can forget all that. It's much more like a gentle, systematic handshake, a welcome to the world from a healthcare professional who's about to become one of your baby's biggest allies.
Exactly. Think of it as a careful head-to-toe exploration of your baby's amazing new body. And the goal, well, it's pretty simple but also incredibly important, to catch any potential issues super early, making sure that from their very first breath, they're set up for a healthy, thriving life. Now, this whole process has an official name. It's part of the Newborn and Infant Physical Examination National Screening Program, or NIP for short. You can just think of it as a standard roadmap that helps guide every newborn's first health journey.
And this isn't something that waits around. This big, important first exam is done within the first 72 hours of a baby's life. It's truly one of the very first and most crucial milestones in their brand new journey.
Now, while the exam really does cover everything, it has a special focus on 4 key areas: the heart, the hips, the eyes, and for boys, the testes. Finding any potential issues here in just the first few days can make a world of difference for a child's future. It can turn what could be a major health challenge into something totally manageable.
And hey, this isn't just a one-and-done kind of thing. To make sure nothing is missed as your baby grows and changes in those early weeks, the whole examination is done again between 6 and 8 weeks old. It's like a second look, a follow-up chapter to make sure that strong, healthy start continues.
But, before a single touch, a really important conversation has to happen. This isn't something that just happens to a baby. It's a process that happens with their parents, right there, by their side. It's all about partnership, right from the very beginning.
So the examiner will start by congratulating the new parents and making sure they have their consent. Then they'll ask a few gentle questions. Is there any family history of certain conditions? How's feeding going? Have they had a wet diaper yet? And finally, they'll just take a quiet moment to observe, just watching the baby's posture and how they move naturally. Okay, with that foundation laid, the physical tour can begin, and we start right at the very top with the baby's head and face.
You'll see the doctor's hands are incredibly gentle as they feel the head's shape and size. They'll trace the lines where the skull bones meet, those are the sutures, just to make sure they haven't fused together too early. They'll check the fontanelles, the soft spots, to make sure they aren't bulging or sunken. Even the position of the ears gets a careful look.
Now, moving to the face, we arrive at a really crucial checkpoint for the eyes. The examiner is looking for something very specific here, a little something called the red reflex.
This test sounds fancy, but it's so simple and so powerful. Using a tool called an ophthalmoscope, the doctor shines a light into the baby's eyes. In a healthy eye, you get this reddish-orange glow reflecting back. If that glow is missing, or if it looks white, it can be an early warning for some rare but serious issues. So this quick, totally painless check is absolutely critical.
The tour keeps going with a gentle look inside the mouth. A finger will sweep across the roof of the mouth to check for a cleft palate, and a quick peek under the tongue screens for a potential tongue tie. Then, a gentle check of the nostrils makes sure they're clear for easy breathing.
All right, from the head, our tour travels down to the very core of the baby's body, the chest and the abdomen, which is home to the heart, lungs, and tummy. First up, the vital signs. And this is something that can really surprise new parents. A newborn's heart just races along at 120 to 160 beats per minute. And they take these tiny, quick breaths, about 40 to 60 a minute. These super fast rhythms are completely normal, and the examiner keeps these numbers in mind as they listen in.
So, with a stethoscope, the doctor listens to the heart, tuning in for any unusual sounds or murmurs. But listening is only half the story. They also need to feel the baby's pulses, specifically in the arms and, most importantly, the femoral pulse down in the groin. So why is that little pulse in the groin so important? Well, because if it feels weak or it's absent, it can be a telltale sign of a condition called coarctation of the aorta, which is a narrowing of the body's main artery. It's just a perfect example of how a simple physical check can be a total lifesaver.
Okay, now we move to a highly specialized part of the examination. This one focuses on the baby's hips, and it's all about screening for a condition that affects how that hip joint is formed.
The condition is known as developmental dysplasia of the hip, or DDH. In simple terms, it just means the ball and socket of the hip joint haven't quite formed a perfect fit. And to check for this, the examiner does two very specific, very gentle little moves.
They're called the Barlow and Ortolani tests. With the Barlow test, they apply gentle pressure to see if the hip is a little unstable. With the Ortolani test, they gently check if an unstable hip can be guided back into place. What they're listening and feeling for is a distinct clunk, a little sound that signals a potential issue that's going to need a closer look with an ultrasound.
Our tour is almost at its end, and we finish with a little glimpse into the baby's amazing developing brain and nervous system. And we see it through a series of fascinating, totally instinctive reflexes. These are the primitive reflexes, and they're just hardwired into every newborn. There's the Moro, or startle reflex, where if they suddenly feel like they're being dropped, their arms fly out. It's like they're trying to catch themselves. Then there's that powerful grasp reflex, where they instinctively clench your finger with surprising strength. And of course, the suckling reflex, that automatic need to suck when the roof of their mouth is touched. But these aren't just cute, random actions. They're actually powerful signs of a healthy, developing nervous system. Seeing these reflexes tells the examiner that all the communication pathways between the brain and the body are working just like they should be. It's a quick and effective check of their neurological health. So, there you have it. From head to tiny toes, this first exam is so much more than a checkup. It's a reassuring and vital first step. It's the first chapter in a baby's health story, and it sets the stage for a healthy life, which just leaves us with the exciting question, what incredible milestones are going to fill all the chapters to come?